Now, today we will be talking about the cardiac cycle. And cardiac cycle we will be discussing in two fashions. In one way, we will be discussing cardiac cycle while I will be doing different diagrams. And in second phase, we will discuss the cardiac cycle when I will be presenting the events during the cardiac cycle graphically. So first of all, let's see cardiac cycle, all the events which occur during one cardiac cycle means all the mechanical events which occur during one systole and one diastole. First of all, what is cardiac cycle? One cardiac cycle is equal to one cardiac cycle is equal to one systole plus one, yes please, one diastole. Systole mean contraction and diastole mean relaxation, right? Now first of all, we start the events from the left heart from atrial contraction, and the events which I will present in the diagrams in the left heart, basically similar events occur in the right heart. Let's suppose here is left atrium, here is left ventricle and aorta, right? Now, we have to study the events in the left ventricle. Number one, when atria contract. Let's suppose in this diagram, I am presenting the phase of cardiac cycle when left atrium is contracting. Now, listen carefully, that when we talk about the cardiac cycle, we have to take care of the three chambers. Number one, in a particular phase, what is happening in the atrium. Number two, in the same phase, what is happening in ventricle. Number three, in the same phase, what is exactly happening in aorta. Again, let me repeat it. When we are going to discuss this particular phase of cardiac cycle, right, what we have to discuss, what is happening in atrium, what is happening in ventricle, and what is happening in aorta. If I say that this is the phase of atrial contraction, then it means that mitral valve should be closed or open. This should be open. Is that right? But at this very moment, aortic valve will be closed. Aortic valve will be closed. It means that during atrial contraction, there is a communication between the left atrium and the left ventricle, but there is no communication between the left ventricle and aorta. It means for the left ventricle, input system is working, but for the left ventricle, output system is not working. Is that right? Now, before the atrial contraction start, about 80% of ventricular filling is already done. About 80% of ventricular filling is already done before the atrial contraction start. It means that atrial contraction, when it occurs, it just adds the last 20% of ventricular filling. Now this point is very important. As I told you that 80% of ventricular filling is passive. It does not require atrial effort. It means if someone has atria which are mechanically not working, right, still 80% of ventricular filling will be done and patient will not suffer significantly. Is that right? Atrial filling, by the atrial contraction, the last 20% of ventricular filling which is done by active atrial contraction, that really becomes more valuable to human beings when they are physically active, that is during exercise, right? Now, when left atrium will contract, naturally the pressure in the left atrium will go down or up? The pressure in the left atrium will go up, right? So let's suppose this was the pressure in left atrium. As soon as left atrium contracted, the pressure in left atrium slightly increased. So this wave is produced when there is increased pressure within the left atrium due to atrial contraction. And this wave is called, yes please, which wave? A wave. This is a pressure wave. This is a pressure wave. It is produced in which chamber? In left atrium. Of course, all the events which occur on the left side of the heart with slightly different pressures, the same events occur on the right side of the heart. But first we will discuss the events on the left side of the heart. So what is A wave? A wave is pressure wave. Why it is produced? It is produced due to atrial contraction. Where it is produced? It is produced within left atrium. But listen, when atrium is contracting and pressure in atrium is increasing, we must notice that mitral valve must be open in a healthy person. So it means all the pressure which is present in the atrium is easily communicated to the ventricle. It means that when pressure in the atrium increases, of course, blood moves into, yes, ventricle. And when blood moves into ventricle, that pressure is transferred to which chamber? Left ventricle. So we can say that at this particular moment, when atrium is contracting, before that, just before the contraction of the atrium, pressure here was 0. It was very less pressure. It was a relaxed chamber. But as soon as atrium contracts, it pushed the last part of the blood into it, the pressure start increasing. But it's a very mild increase into pressure. Just after the atria completes its contraction, the action potential has entered into ventricles, of course through the AV node. And now it is the turn of the ventricle to contract. So in the next phase, what we'll see that now ventricular contraction will start. So this phase, we'll label this phase as phase of, yes please, phase of atrial contraction. Now we are moving to the next phase. Well, I will just brief it. What happens during atrial contraction? Left atrium contracts, pressure wave A is produced in the left atrium, mitral valve is open and pressure and the volume are transferred to the left ventricle, but you have to remember that aortic valve is closed because pressure in the aorta is more than the pressure in the ventricle at this moment, right? So in this phase, you must know what is happening in atrium, what is happening into ventricle, what is happening into aorta, and you must be clear what happens to input valve, which is mitral valve, and what is happening to output valve, which is aortic valve. Are you clear about this? Any question in this phase? Rahul? No question. After that, naturally current will come, depolarization will come to the left ventricle. And now it's the onset of left ventricular contraction. Of course, by that time, it is in the next phase, the atrial contraction has been completed and we are entering into phase of atrial relaxation but onset of ventricular contraction. Now, in the next phase, now again I will show the all three chambers. This is the input chamber which is atrium. Here is ventricle, the major pump, and this is output chamber. What is this? Aorta. Now in the next phase, now it is properly filled. It is properly filled, but as you know already, at the onset of this phase, already aortic valve is closed. At the onset of ventricular contraction, aortic valve is already closed because pressure here is about 80 millimeter of mercury. Right? Now, what really happens at this stage that when ventricles start contracting, pressure in the ventricle start building. Right? Pressure in the ventricle is going up, and pressure in the ventricle is going up. Let's suppose pressure in the ventricle becomes around 5 millimeter of mercury. This is a pressure where intraventricular pressure becomes more than atrial pressure. And ventricles start contracting at the very beginning of the contraction, right? Pressure go around 5 or 6 millimeter of mercury. Now pressure in the ventricle is slightly above the pressure in atrium. As soon as you can say pressure in the ventricle become more than atrium, blood will try to go back and mitral valve will be closed. That's very good. So mitral valve will be closed. Now mitral valve is closed because pressure in the ventricle is more than, yes please. Pressure in the ventricle is more than atrial pressure. Is that right? Now, but ventricle will continue to contract. Ventricle will continue to contract, right? It is squeezing the blood. But the point which is very important at that particular moment is that now ventricle will be contracting as a closed chamber. Why? Because as soon as, look here please, as soon as the ventricle started contracting, it shut off back valve. Back door is closed. It has closed the which valve? Mitral valve. But yet the pressure in the ventricle are not so high to open the aortic valve. Due to this reason, now at the pressure of 5, I can say there was star 1 event. What was star 1 event? Closure of mitral valve. And closure of mitral valve produces a sound, right? Closure of the mitral valve produces a sound, and that sound is called first heart sound, S1. Closure of mitral valve will produce the S1, right? S1 is produced by closure of mitral valve in the left side of the heart and closure of the tricuspid valve on the right side of the heart. Is that clear? Now, after that, once this valve is closed and yet this aortic valve is not opened, now ventricle will contract as a closed chamber. Ventricle will contract as a closed chamber. When ventricle is contracting as a closed chamber, pressure in the ventricle start going up, right? And let's suppose the pressure in the ventricle goes up to 80. Now up to the pressure of 80, right, ventricle is contracting as a closed chamber because it has closed the back valve, but it could not open yet the outflow valve, that is aortic valve. And this phase of, and of course, again, the good boys should remember that what was happening during this phase to atrium and what was happening during this phase to aorta. At every phase of cardiac cycle, good students should know that at a particular phase, what happened to input chamber, what happens to pumping chamber, what happens to output chamber. Now, we have discussed only this chamber, that during this phase, only ventricle has taken the pressure enough to close the mitral valve. It progressively took the pressure up, but yet it could not open the aortic valve, right? It means during this phase, ventricle was contracting as a closed chamber, or we simply call this phase, yes, what is the name of this phase? Isovolumetric contraction. This is the phase of ventricular systole. It is the early phase of ventricular systole. Now, why we call it isovolumetric contraction? Because during this phase, do you think any blood is entering into ventricle?
No.
And do you think there's any blood leaving the ventricle?
No.
No. So it means the amount of blood in the ventricle is same throughout this phase. So we say it is isovolumic, right? And size of the ventricle remain also same. So it is isovolumic as well as isometric, or simply we say this stage of ventricular contraction when backward valve are closed and forward valve are yet not open. So ventricle is contracting as a closed chamber and its volume and its size does not changes. But you must remember that during this phase, pressure within the ventricle rapidly increases and it is going to approach the pressure present in aorta. Meanwhile, when this isovolumetric contraction was going on, what was happening in atrium? About atrium, if we talk, when atria contracted, then there was, you remember, A phase. This is atrial contraction. And at the onset of ventricular contraction, when mitral valve was bulging into atrium a little bit, there was a little jerk produced here in the pressure, and this is called C wave. So it means if you have a manometer or pressure measuring device in left atrium, when atria contract in this first phase, you will find A wave. But after that, when atrial contraction is finished, A wave goes down, ventricular contraction start, and with the onset of the ventricular contraction, there is a back pressure to atrium, especially mitral valve closes and produces a little bulge in atrium, and that produces a slight increase in the pressure within atrium, and that slight wave is called C wave. That is called C wave. After that, what really happens, that yes, here are your lungs. You know, the blood from the lungs is, venous blood from the lung is coming to where? To the atrium. But because ventricle is contracting, it is keeping the mitral valve closed. So this blood which is coming, it will keep on accumulating in atrium. So it means atrium will work as a tank. Now atrium will work as a tank and it will keep on accumulating the blood returning from the lungs. It will keep on accumulating the blood which is returning from the lungs. Is that right? And of course, when the situation is occurring, look here, there is a wave produced and slightly increased pressure, and this pressure is increasing due to venous return coming from the lungs and accumulating and dilated atrium. Is that right? Now, you must be able to tell what three things are happening during, what are the important events during isovolumetric contraction. You must start like this, that ventricle start contraction, it closes the mitral valve, it keep on building the pressure, but yet it has not opened aortic valve. During the, so there is no volume change and no size change. So we call it isovolumetric contraction of ventricular systole, early part of ventricular systole. But a good student should also mention that what is happening to atrium during this time and what is happening to aorta at that very moment. I told you at the beginning of this phase, there is a little increase in pressure of the intra-atrium. Then atrium pressure gradually increases. This is due to accumulation of the blood which is returning from the lungs to the left atrium. Meanwhile, what is happening to this funny thing? What is this funny thing? Aorta. What is happening to this? It is, elastic vessel. It is squeezing whatever blood it has. It is squeezing that blood to the peripheral arterial system. Is that right? So what aorta is doing? Due to its elastic properties, right? It is squeezing the blood, whatever blood it has, to push it forward into more peripheral part of arterial tree. Am I clear? Now, as soon as, now listen carefully, as soon as the exact moment when pressure in the ventricle become more than aorta, which valve will open? Aortic valve will open. Excellent. Okay, let me make the aortic valve also green so that the color things remain black. Only the things which I want to show in the pressure things, they remain black. Now, in the next phase, as soon as pressure in the ventricle become more than pressure in aorta, aortic valve will open. As soon as the aortic valve will open, there will be termination of isovolumetric contraction and next phase will start, that is the phase of rapid ejection of blood. Of course, this is ejection of blood and this ejection of blood is from ventricular chamber to aortic chamber. So let's draw that phase and look what really happens during that phase. Now, in the next phase, again you have to draw the all three chambers: atrium, ventricles and aorta, right? Now, yes, after isovolumetric contraction, as I told you, when ventricles start contracting, they take the pressure in the ventricle more than atrial pressure, and as soon as pressure here become more than atrial, which valve closes? Mitral valve closes. This we have already discussed. Then what we are talking about is that when it was isovolumetric contraction, pressure has gone up to 81. As soon as it become 81, right, pressure in the ventricle become more than aortic. And which valve will open now? Aortic valve. Yes, please. Aortic valve. And when aortic valve will open, what will happen? Blood will start ejecting rapidly from where? From the ventricles. And blood is being pumped where? To aorta. And now, as you know, aorta is what kind of artery? Muscular or elastic? So it will stretch out. Aorta will stretch out. It is receiving the blood. You know, many things when they receive the things, they stretch out. So aorta will stretch out, right? As soon as the aorta will stretch out, advantage of this thing is that with little increase in its pressure, it can accommodate more volume, right? But you know, ventricles are really now very aggressive and they keep on contracting, systole continues, and what really happens that now aortic valve is open, so volume, blood volume from the ventricular chamber is constantly being pushed into aorta, and meanwhile pressure in the ventricle may reach to the peak of 120. The pressure may reach up to 120. But now listen carefully, that aortic valve is open, so it means now left ventricular chamber and aortic chamber are behaving like a single chamber. So pressure changes which are occurring in the left ventricle will be faithfully transferred to the aorta. So pressure in aorta, which was previously 80, as soon as the valve open, pressure in the ventricle goes up to 120, and of course pressure in aorta will also go to 120. Is that right? And during this phase, the blood is very rapidly being ejected. But you know, nothing lasts forever. Even rapid ejection cannot last forever, you must be knowing, so it has to slow down. So what really happens in the next phase? But before I move on to the next phase, we have to study this phase with three standards. What happened in atria, what is happening into ventricle, what is happening in aorta. We have already discussed what is happening in ventricle, that this is a phase when ventricular pressure is more than aortic pressure, so aortic valve is open and blood is from the ventricle being ejected rapidly into aorta, right? And of course, what is happening to aorta? You can understand, if it's pushing the blood into aorta, then aorta is receiving the blood. There's no fun in explaining that, right? And pressures, whatever pressure changes are coming into ventricle, once aortic valve is open, the same changes are now being transmitted into aorta. Meanwhile, this humble chamber is still working as a tank, It is still working as a reservoir. It is still receiving the blood from, yes please, from where? From the lungs, right? And due to that reason, so what happens to them? You know, in the beginning there was a wave which was due to what thing? Atrial contraction. In the next phase, when isovolumetric contraction started, there was C wave. And then this wave of accumulation of venous blood is called V wave. So this V wave is continuing, right? So we can say that when ventricles are contracting, atria are just acting as reservoirs and they are receiving whatever blood is coming to the atrium. Am I clear?
Yeah, is that V wave like a flat line or?
V wave, no, it's a gradual look. We should draw really like this. Okay, for your personal interest, I will draw it more prominently. This is the A wave, right? This is atrial contraction pressure, right? Please don't confuse with P wave, which is representing electrical event. This is A wave, which is representing mechanical event. After that, there was C wave, which was representing onset of ventricular contraction. And of course, after that, this is the V wave, which is showing how the pressure is progressively increasing into atrium as atria is accumulating more and more venous blood coming from the ventricles, and atria is behaving like a reservoir or as a tank. Is it clear? Now, this phase during which ventricle is very rapidly ejecting the blood into arterial tree, especially in aorta, which is elastic vessel, and as blood is rapidly entering from the ventricle to aorta, due to its elastic compliance, it stretches out, right? And pressure in the ventricle are faithfully transmitted to aorta as aortic valve is fully open, right? Or we can say ventricle and aorta are behaving as the same chamber, right? This phase is called rapid ventricular ejection phase. Please remember, it is ejection phase. Spellings should be carefully written. It is rapid ventricular ejection phase, right? But you know, things can never continue to eject forever. So once it has squeezed the blood with high pressure and there has been rapid ventricular ejection, after that ventricles start relaxing. But before it starts relaxing, it goes to the next phase, and during the next phase, the speed of ejection of blood become less. That is why next phase is called slow, yes, slow ventricular ejection phase. Now, again, let's consider the three chambers during the slow ventricular ejection phase. As we have discussed, that throughout the ventricular contraction, mitral valve will remain closed as pressure in ventricles remain constantly higher than the pressure in atrium. So mitral valve is closed, and at this particular phase, still atrium is acting as a reservoir. It means that V wave is still continuing. Ventricle is, yes, still contracting, but because some amount of the blood has been ejected, so pressure in the ventricle is not that much, and pressure in the ventricle start falling. And aortic valve is still, yes, open, right? And you remember pressure when ventricle started contraction at pressure of 5, what was closed? Mitral valve was closed at pressure of 81. Which valve was open? Aortic valve was open at pressure of 120. It was the maximum ejection phase, rapid ejection phase. Now we are entering into phase when gradually pressure start falling, right? And when pressure is starting falling, so naturally the ejection has become slow. It's no more that fast. Is that right? So this is called slow ejection phase. Again, let me repeat it. What happened to these three chambers during the slow ejection phase? First of all, you must remember that atrium is still working as a reservoir. It is still accumulating the blood, returning back from the lungs. So we can say atrium is having still the pressure wave building up, and that pressure wave is called V wave, number 1. Number 2, mitral valve is closed. Number 3, ventricle is still contracting. It has already completed isovolumetric contraction. It has already completed rapid ejection phase. Now it is entering into slow ejection phase, right? Still intraventricular pressure is more than intra-aortic pressure. Blood is still ejecting from the ventricle to the aorta, but pressure start falling in ventricle. As pressure start falling into ventricle, in the same way pressure in aorta also start falling. But one thing which you have to remember, that as aorta is an elastic vessel, it keep on squeezing the blood, and blood keep on moving forward into peripheral arterial tray. Is it? Now, after that, the next phase, which is very important one, the next phase, what really happens? Next phase is that left ventricle start relaxing. It means there is onset of ventricular diastole. Again, this was the atrium, and here is the left ventricle, and left ventricle now start relaxing. Now, when left ventricle will start relaxing, naturally pressure in the left ventricle will start falling down, right? Now, let's concentrate on the left ventricular chamber. What is happening? It is relaxing. When left ventricle is relaxing, again, before we really know the whole story, look at the innocent atrium. It is still busy with accumulating the blood which was coming from lungs. It means still here, after the A wave was there, C wave was there, and now V wave is still continuing, right? What is happening to this? It has started relaxing. When it has started relaxing, it means this pressure will rapidly fall down. Now, if you remember, review from the beginning, when ventricle started contraction, pressure 0 to 5, it became more than atrium. At this particular point, at star 1, the event was mitral valve closure. Then you remember we discussed the pressure will go up to 81. Up to this point, what really happens? That isovolumetric contraction. Then what was this phase? Rapid ejection phase up to 120, and then there was slow ejection phase. Right? Meanwhile, if we really concentrate what was happening into aortic chamber, if we really concentrate, I told you that as soon as aortic valve was opening, the pressure in the ventricle and aorta became equal. But when pressure in the ventricle was rising, aortic pressure was also rising. But when ventricular pressure started falling, aortic pressure also started falling down. And when there is onset of ventricular diastole, pressure in the ventricle rapidly start falling. When pressure in the ventricle rapidly start falling down, then aorta squeezes its blood and column of blood in aorta try to come back. Where to come back? They try to fall back into ventricle, which is having progressively lower pressure. But as soon as the column of blood in aorta try to fall back, there is closure of, yes please, aortic valve. There is a closure of aortic valve, and as soon as there is closure of aortic valve, we can say that relationship between left ventricle and aorta is disconnected. The connection between the left ventricle and aorta is disconnected. Right now they become independent chambers, so their pressures will go away from each other. Right? So aortic pressure will remain the same way high, but ventricular pressure during this time will start falling down. But you have to remember one thing, that when pressure in the ventricle is rapidly falling down, right, aortic pressure is more than intraventricular pressure, so aortic valve is closed. But mitral valve is also closed, it is not yet open because intraventricular pressure, even though it is rapidly falling down, it is still more than intra-atrial pressure. Again, let me repeat it. When ventricles start relaxing, intraventricular pressure starts falling rapidly, right? At the beginning of fall in the intraventricular pressure, there was closure of aortic valve, and after that it started relaxing as a closed chamber. It started relaxing as a closed chamber. Why it was relaxing as a closed chamber? Because pressure in the ventricle, even though it is falling down, is still higher than the pressure in atrium, right? So until pressure in the ventricle, in spite of falling down, is more than the pressure in atrium, it will keep on relaxing as a closed chamber, and we will say that there is, yes, isovolumetric relaxation, right? And during this phase, again, let's first of all label this phase. What should be the name of this phase? Yes, isovolumetric relaxation phase. It means onset of systole is isovolumetric contraction, onset of diastole is isovolumetric relaxation. During onset of the systole, during isovolumetric contraction, pressure is rapidly taken to the aortic pressure, and in case of isovolumetric relaxation, pressures are rapidly dropped so that they should eventually become less than atrial pressure. So during diastole, the pressures rapidly fall down so that pressure in the ventricle should become eventually less than atrial pressure. So let's see in next phase what really happens, right? Now what really happens in this stage is that pressure in the ventricle become really less than pressure in atrium, and meanwhile, of course, you will not forget, still the same thing happening, these innocent atria working as a tank, and accumulating blood. Now we go to the next phase. Now in this next phase, aortic valve is already closed and aorta and left ventricle are disconnected. But don't forget, aorta is not doing anything. Whatever blood it has received previously, it is squeezing that blood into arterial tray. Meanwhile, I told you this is relaxing, and when it is relaxing, pressure in the ventricle has become less than atrial. But still, ventricle was having some blood which was left over after the previous ejection, and this blood which was left over within the ventricle after the previous ejection, this is called end systolic volume. The volume of the blood present in the ventricle at the end of systole. Of course, here was also end systolic volume. But at this very moment, as soon as pressure in the ventricle become less than the pressure in atrium, what really happens that mitral valve will open, and as soon as mitral valve will open, now atrium and ventricle are connected, and all the blood, just remember, atrial contraction produced A wave, C wave was with onset of ventricular contraction, and until ventricle was contracting there was a which wave? Yeah, it was V wave. So as soon as mitral valve open, this V wave fall down, because blood which was accumulated into atrium, right? Again, let me tell you what really happened. That as soon as left ventricle started relaxing, pressure in the left ventricle chamber rapidly start dropping. A time came when pressure in the ventricle became less than the atrial pressure. When pressure in the ventricle became less than atrial pressure, then of course, which valve will open? Which valve will open? Mitral valve will open, right? And the blood which was previously accumulated here and producing pressure of V wave, that blood will rapidly fall into, yes, ventricle. And this rapid fall of blood into ventricle is called rapid ventricular filling. But even though this is rapid ventricular filling, but it is without atrial contraction, because atria is not contracting, so we say even though rapid filling, but it is passive filling. So we can say, what is this filling coming in?
80%.
Yeah. What is this? It is rapid passive ventricular filling. So ventricle had some blood left over from previous contraction. Then as soon as mitral valve open, there is filling of the ventricle, and this is very rapid filling because atrium was full of accumulated blood, and this accumulated blood rapidly rushed into ventricle. Is that clear? Now the next phase comes. Next phase is very interesting. Of course, this phase should be labeled as, this is ventricular filling phase, rapid passive ventricular filling phase. Is that right? This is also ventricular diastole. This, right? This is also ventricular, yes, diastole. Then ventricular diastole will continue, and the next phase is very important. Then what really happens during this phase? Now, in this next phase, look this diagram very carefully. Of course, aortic valve is already closed. Aortic valve is already closed. Ventricle is disconnected with the aorta. It is trying to get the blood from input system. So which valve is open? Mitral valve is open, right? Mitral valve is open, right? We already know, you remember, the blood which was left over from previous contraction was end systolic volume, and due to rapid filling, some blood was added. What was that blood? Yes, please. Rapid passive ventricular filling. After that, accumulated blood has fallen. Accumulated blood has fallen into ventricle. In the next phase, what really happens? Now you have to look at this diagram very carefully. Of course, here are your friends called lungs providing you with the oxygenated blood. Now all the blood, venous blood, which is coming from the lungs, look, because valve is open, do you think it will act as a reservoir? No. So this blood will directly add to the filling, ventricular filling. Is that right? It means now atrium is not working as a tank. Now atrium is not working as a reservoir. Now atrium is working just as a conduit. Atrium is just working as a passage. Atrium is just working as a pipe. Atrium is just working as a connection between the venous return from the lung and the ventricle. This phase is also, it is rapid filling or slow filling? It is, of course, it's not accumulated blood, slow filling, but passive because there is no contraction. There is no atrial contraction. Atria is just acting as a conduit. So we call it, yes, slow passive ventricular filling, right? Or this phase, which is the longest phase of the diastole, this phase is also called, yes, can you tell me the name of this phase? It is called, okay, one way is called slow passive ventricular filling. Other name is diastasis. Diastasis. This is called diastasis. Is that right? Just after that, SA node again fires. And when SA node fires, you go to the, yes, next stage. And what is the next stage? Atria will contract. And when atria will contract, what will happen? Last phase of ventricular filling. But this phase of ventricular filling is which phase? Active or passive? Active. And so forth until your life is continuing. This cycle is repeated, right? So how many stages of cardiac cycle we have discussed? Just a minute. We start from here. First atrial contraction. Now please look here. This is atrial contraction. It means this is atrial systole. After that, this phase is atrial diastole. With onset of ventricular contraction, this is onset of atrial diastole, of course. This is venous blood accumulated, still atrial diastole. Ventricular systole continuing, but there is atrial diastole. Ventricular diastole started, but still atrial diastole. And now, what is this? Is it atrial systole? No, it is still atrial diastole. It is also atrial diastole. So it means atrial diastole is very long. When your heart rate is around 72 beats per minute, atrial systole is only 0.1 second. And atrial diastole, in all these phases, atria is relaxed. So what we can say, atrial diastole is a very, very short phase or long phase? Yes, it is long phase. So this is atrial diastole. So during the atrial diastole, how atria work? Look, atria work as a simple, yes, tank, reservoir. It is working as a reservoir here, as a reservoir here, as a reservoir here, as a reservoir here. Here, it acts as a communication channel and accumulated blood comes to the ventricle. Here it acts as a simple conduit. And here is atrial contraction. But when we superimpose the concept of ventricular systole and diastole, then you look at it. That this was your ventricular, yes, systole, right? Which was isovolumetric contraction. Again there was ventricular systole, rapid ejection phase, then slow ejection phase, again ventricular systole. So total ventricular systole is about 0.3 seconds. So it is longer than atrial systole. Here is ventricular diastole, and again ventricular diastole, and of course here is also ventricular diastole. Is that right? And of course a ventricular diastole is about 0.5 second, because both together should make 0.8 second if your heart rate is around 72 beats per minute. Is that right? Any question? Now we will incorporate the concept of heart sounds with the different phases of cardiac cycle. The first most important event is when left ventricle contracts. With the onset of left ventricular contraction, there is closure of which valve? Mitral valve. And if you keep in mind the right ventricle also, right side of the heart, so when both ventricles contract, right, at the beginning of ventricular contractions, intraventricular pressures go up and mitral valve closes on the left side and tricuspid valve closes on the right side. The closure of mitral and the tricuspid valve at the onset of ventricular systole produces a sound which is called first heart sound. So this is first heart sound, and first heart sound is produced when there is onset of ventricular systole and there is closure of mitral valve and tricuspid valve, right? Then we have to see that, as I told you, in the next phase, when ventricle will contract and pressure in the ventricle will become more than intra-aortic pressure, then of course aortic valve will open, and opening of aortic valve will produce which sound? Yes, please. No sound. Healthy valve, when they open, they don't produce any sound. Is that right? Yes. If your valve is producing sound while opening, there may be something wrong with your valve. So opening of the aortic valve is without any sound. Then in the next stage, in rapid ejection phase, again there is no sound. In slow ejection phase, also rapid ejection phase and slow ejection phase, in both phases no sound. Then left ventricular diastole start. When left ventricle start relaxing and intraventricular pressure rapidly drops, and blood in the aorta, when it try to come back, it closes which valve? Aortic valve. And actually on the left side of the heart, aortic valve closes, and on the right side of the heart, pulmonary valve closes, and closure of the aortic valve and pulmonary valve produces a sound which is called, yes please, that is of course not S1. Now the sound which is produced is S2. So we can say S1 was produced due to closure of mitral and tricuspid valve in the beginning of ventricular systole, and S2 was produced by closure of aortic and pulmonary valve at the end of ventricular systole, and of course at the beginning of ventricular diastole. So we can say between the S1 and S2 there is ventricular systole, because at the beginning of ventricular systole the sound produced is S1, because when ventricle contract, mitral valve and tricuspid valve close, that produces S1, and when ventricle relax, that closes the aortic valve and pulmonary valve, that produces S2. And sometimes when there is rapid ventricular filling, at the last phase of rapid ventricular filling, is that right? The last phase of rapid ventricular filling, sometimes, especially in young people after exercise, right, heart may produce a sound, and this humble sound is called as 3. Is that right? And then if in some patient hypertrophied atrium is pumping against a hypertrophied ventricle, then atrial contraction may produce a sound. Again, let me tell you that sometimes if there are atria which are contracting against stiffened ventricle. Stiffened ventricle means hardened ventricle. More truly speaking, hypertrophied ventricle. If your ventricle is hypertrophied, then atria has to put extraordinary effort to push the blood into hypertrophied ventricle. And when atria contracts strongly, sometimes the flow of blood from atrium to the ventricle produced by the atrial contraction may produce a sound, and that sound is called S4, and that is usually pathological sound. Is that clear to everyone? So once you have learned this thing, one more thing which I want to highlight, the phases here I have shown in the left heart, but actually exactly similar phases also occur in the right heart, except the pressures in the right side of the heart are lesser than the pressures in the left side of the heart. For example, the pressure in pulmonary artery, pressure in aorta varies between 80 to 120, but pressure in pulmonary artery varies between 8 and 25. In the same way, when we talk about left ventricular pressure varies from 0 to 120, left ventricular pressure, but right ventricular pressure varies from 0 to 25. Is that right? So the cardiac events on the right side of the heart are similar as on the left side of the heart. The only difference is pressures. Is that right? Now, we will discuss the heart sounds later on in a big detail with murmurs, right? There will be a full separate lecture on that, right? Right now, we just try to correlate the heart sound with the phases of the cardiac cycle. You have a question?
Is there any pathological manifestations with S3 besides a child with exercise?
Look, S3 may be seen sometimes in young people, especially after the exercise, because when you are doing exercises, rapid venous return to the heart, right, from the peripheral tissue, that may produce S3. But S4 is usually pathological. Is that right? Yeah? S3 is a sound produced due to rapid ventricular filling, right? And S4 is produced usually when there is a hypertrophied ventricle having a forceful contraction against a stiffened ventricle. Am I clear? Okay. Now we will present this thing graphically. All these events in a graphic fashion. So now we will be presenting the cardiac cycle in graphic fashion, right, as a graph. Let's suppose this horizontal line is displaying the time scale and this vertical line is showing the pressures, pressure changes, and here is, of course, time. Now, if we start with the cardiac cycle, you know there are three parameters which we have to check. The relationship of pressure activities in the atrium, pressure activities in the ventricle, and pressure activities in the aorta. First, we will discuss these three dynamics, right? Now, in the beginning, in the very first phase, when atrial contraction start, you remember there was atrial pressure goes up, and this was called which wave? A wave. And as atrial pressure goes up, along with that, ventricular pressure also goes up. And when atrial contraction completes, ventricular pressure contraction also completes. Then what really happens? Meanwhile, when atrial contraction is going on, right, at that very moment, the pressure in the aorta is about 80 millimeter of mercury. Is that right? Now we have to consider three chambers. Let's look, I will draw the three chambers here. That here atria is contracting, right? A wave and same pressure transmitted to, what is this? Ventricle. So red line also shows increase in ventricular pressure, and of course this valve is closed. Mitral valve is open at this stage, but aortic valve is closed. So what really happens, because the aortic valve is closed, so pressure in the ventricle has nothing to do with the intra-aortic pressure. Aortic pressure is around 80. Now what really happens, that as soon as in the next phase, what happens? This onset of ventricular, yes. What is the next phase? Yes, please. The onset of ventricular contraction. And as soon as you remember that ventricle start contraction, mitral valve closes, and now heart has to pump as a closed, ventricle has to pump as a closed chamber. Because mitral valve is closed, pressure is rapidly building in ventricle, pressure is rapidly building in ventricle, but aortic valve is yet not open, but pressure is jumping from atrial pressure to the aortic pressure. So what we really see at this phase, now this was your, the first phase was atrial contraction, second phase is isovolumetric Isovolumetric contraction. When we talk about the isovolumetric contraction, right, even though in time scale it should be, you can say, shorter time duration, I will draw it more narrowly. So now what really happens? Here is your aortic pressure, isn't it? And here is your atrial pressure, and there is onset of ventricular contraction. And when there is onset of ventricular contraction, it will close which valve? Which valve? Yes, please. It will close mitral valve. And after the closure of course, closure of mitral valve will produce which sound here? Can you tell me which sound here? S1, mitral valve closure, and of course other side tricuspid valve closure. And along with that, now what really happens? Intraventricular pressure rapidly goes up. Where it is going? It is going to meet the pressure of aorta, right? It is going to meet the pressure of aorta, right? So we can say that this is what has happened, that pressure from the ventricle rapidly during isovolumetric contraction rise rapidly, and from the atrial pressure it jumped to the aortic pressure, right? Meanwhile, with the onset of ventricular contraction, I told you there was a little elevation in which pressure? Atrial pressure, and this was called which wave? C wave. Is that right? After that, what really happens? Let's concentrate on the next stage. In the next stage, what really happens is that there is a stage of pressure in the ventricle has gone more than aortic pressure. And when ventricular pressure becomes more than aortic pressure, there is the next phase, and that phase is called rapid. Yes, what phase? Rapid ejection phase. And in the rapid ejection phase, you remember that atrium is closed, mitral valve is closed, it is acting as a tank, V wave is formed there, and ventricle is still contracting, and now aortic valve is open and rapid ejection is going on. And because rapid ejection is going on and pressure from the ventricle is transmitted to aorta, right? So exactly at this point there is opening of aortic valve, and naturally this is the ventricular pressure which is going up, and because aortic valve is opened, so pressure in the aorta also follows the ventricular pressure. Am I clear? Pressure in aorta follows the ventricular pressure. After that, what really happens? Now we come to the next phase, and that is the phase of slow ejection. In the phase of slow ejection, okay, let me demarcate on the time scale that suppose this is the phase of slow ejection, right? In the phase of slow ejection, now ventricular pressure start falling down, right? Along with that, aortic pressure also start falling down, but at last part of this phase, intra-aortic pressure becomes slightly more than intraventricular pressure, but still blood keep on moving from the ventricle to aorta due to its momentum, right? And the diagram which we can draw here at this stage is, again, with this valve is closed. What is this valve? Mitral valve, and it is still opened, aortic valve, but there is slow outflow, not rapid ejection, and this is still contracting. Is that right? And of course, here from this phase, this phase, this phase, atrium is working as these three phases as a reservoir. Due to that reason, there is progressive accumulation of blood over there. And due to progressive accumulation of blood over there, what is this wave there? V wave. Am I clear? This is called V wave. After that, there is a phase of isovolumetric, yes, relaxation. There is onset of ventricular, what is this? Relaxation. And when ventricular relaxation start, intraventricular pressure have to rapidly fall. But as intraventricular pressure starts rapidly falling, aortic valve closes and produces a sound which is called S. Yeah, what is that sound? That sound is called S2. Is that right? That is S2. That is due to closure of aortic valve, and the pressure in the aorta become the little jerk. It become independent of ventricular pressure, and now ventricular pressure will progressively fall. Isovolumetric, what is this? Relaxation. So intraventricular pressure rapidly fall from aortic pressure back to atrial pressure, right? And eventually what really happens, so this phase, yes, what was this phase? What was this phase? Isovolumetric relaxation. Now during this phase, again this was working as a tank, it was working as a reservoir. But as soon as intraventricular pressure become less than, what was that? Intraventricular pressure become less than atrial pressure, there is opening of mitral valve, and of course on the right side is the opening of tricuspid valve. And when these valves open, which heart sound is produced? No heart sound. Opening of the valve, healthy valve does not produce any heart sound. So what really happens at this particular phase, now as soon as ventricle is completely relaxed, now intraventricular pressure will remain constantly low. Intraventricular pressure will remain low, and at the same time, what is this pressure? Atrial pressure. Atrial pressure will also fall as accumulated blood will fall to ventricle. So this is the atrial pressure, which is very slightly more than ventricular pressure. And this phase we can divide into, this is now ventricular diastole. This phase can be, yes, what is this phase? This was rapid, yes, rapid passive ventricular filling. And here we will diagrammatically show that this mitral valve is opened and now it is receiving lot of blood from atria, but atria are not contracting. Is that right? Next phase diagram is very important to understand that there is a lot of filling, but blood from the lungs is directly coming passively to this. Is that right? So now if you really want to label this, and of course next stage you must be knowing, meanwhile aortic pressures are falling but not much because aorta elastically recoils, right? Meanwhile, you know, at this stage again the same story will happen. What will happen? That atria will contract. Is that right? Then what will happen? Pressure in the ventricle will go up, right? And after that again, you know, as new cycle has started, you must be knowing that what will happen, that ventricular pressure will leave the atrial pressure, rapid ventricular contraction will start, and ventricular pressure will rapidly go up and meet up with the aortic pressure. And as soon as intraventricular pressure become more than aortic pressure, right, then aortic pressure will follow intraventricular pressures. And of course here the next cycle has started. Is that right? Now the point which I want to highlight, if we really label these, right, what was this? This was atrial contraction. What was this stage? Isovolumetric contraction of the ventricle. What was this? Rapid ejection phase of ventricle, of course, and this is slow ejection phase of ventricle, and here it was isovolumetric relaxation. Then what was this? Rapid but passive filling. And at the end of it, if this filling become too fast, then there may be another sound produced. What is this sound called? S3. Is that right? And of course, this was the phase which was called not rapid but slow. No, it was slow. It was slow passive ventricular filling, which is usually the longest phase. And what is here now? Again, the next cycle start, that is atrial contraction. And if atria is contracting against a stiffened ventricle, only then a sound may be produced, which is called S4. Now, another way to correlate these concepts is that you can say that this was, what was this? Atrial, what was this? Atrial systole. And what was this continuing? Up to here? Atrial diastole. And if we go like this from here, what was this? Up to this phase. This was ventricular systole. This is ventricular systole. And of course, what is here? What was this? Ventricular diastole. The point which you have to remember, S1 is at the beginning of ventricular systole and S2 is at the, you can say at the end of ventricular systole or beginning of the ventricular diastole, and S3 is in the somewhere before the middle of the ventricular diastole, and S4, if it is there in some pathological condition, it is just before the next ventricular systole. Now, if you really want to correlate all these things with the pressure changes, then volume changes, volume within the ventricle, you can see the volume in the ventricle here is slightly increased. In this case, volume remain the same. During this phase, volume will remain the same. Here, volume will rapidly go down, then it will further go down, then volume will remain the same. Is that right? Then ventricular volume will start going up and again going up and eventually in the next stage. So what we have to really learn, that volume with atrial contraction, volume in the ventricle increases. During isovolumetric contraction, volume in the ventricle remains same. In rapid ejection phase, volume in the ventricle become less. In slow ejection phase, it becomes further less. And in rapid passive filling, of course, volume become more. Then slow passive filling, again volume become more, and in the end, of course, if next atrial contraction come, volume is again added. So these are the volume changes. Do you have any problem here? Another thing which I would like to highlight with this is that ECG, electrical activity in the heart. Of course, the P wave should be just before the A wave. Is that right? If I make the ECG here, right, where you want me to draw ECG? Should I draw it here or down? On the top. Look, if I draw the ECG, you can understand that atrial contraction, if there is an atrial contraction mechanical wave, of course there should be electrical stimulation of atria just before that. So P wave of ECG should be before that. And then this is onset of ventricular contraction. It means there is a strong what? What is this activity? Ventricular depolarization going on, which has taken all the activity. And of course, during the, what is this? ST phase, ST segment, plateau is there, and you see it is still contracting. But when relaxation starts, it means repolarization has started, and that will lead to which wave? T wave, right? So this is how ECG can be superimposed on that, and of course here should be next P wave with next QRS. I hope you can correlate these things. Is there any question? Little bit, not clear? Electrical activity. It's very easy. No, I will make it clear. Listen. You see, if this is atrial contraction, Now, atrial depolarization should be before atrial contraction or after? Atrial depolarization should be before atrial contraction or after? First electrical event occur and then mechanical event occur. First atria is electrically stimulated, then it mechanically contract. First ventricle is electrically stimulated, then ventricle undergo mechanical contraction. So in the heart, first you have to remember that first there is electrical event and after that there is mechanical event. Now, if I say that atrial contraction is the atrial mechanical event, so electrical event should be just before that. So electrical event for atria is represented by the P wave. So P wave represents what? Atrial depolarization is just before the A wave. P wave on ECG is atrial depolarization and A wave on the pressure is pressure in the atria due to mechanical activity. So A wave is representing mechanical activity, and of course before the atrial mechanical activity there must be atrial electrical activity. Is that right? Now the next point which you have to understand is that look here. Here the pressure, ventricle has started contraction. Pressure has gone very rapidly up. Do you think it's possible without depolarization of ventricles? So depolarizing current is QRS. So this QRS is showing that there is depolarization of ventricles, and if ventricles are being depolarized, of course then mechanical event in the ventricle will start and pressure in the ventricle goes up, right? And their ventricles start relaxing. Of course, just before relaxation, ventricular repolarization should be there. Are you with me? And if there ventricular repolarization there, then of course which is the wave for the ventricular repolarization? T wave. Am I clear? Or any question? And of course before the next cycle, right, before the next atrial contraction, again P wave should come, and before the next ventricular contraction just QRS complex should come. Is it correlated or not yet?